The first time you sell a healthcare practice, you're going to learn a lot in that process. In fact, a lot of the things that become normal by the time the transaction is closed are the very same things that you least expected at the very beginning of the process. What I'm going to do in this video is talk about some of the common misconceptions that sellers have the very first time they sell a healthcare practice, what the misconceptions are, and then how those misconceptions relate to the things that you're likely to learn along the way. Let's get started. One of the first things that a lot of sellers get wrong is they believe that finding a buyer for their healthcare practice is going to be relatively easy, but that the process of actually getting the transaction done in terms of the paperwork and the actual transaction documents is going to be the hard part. For a lot of larger regional healthcare practices that have $5 million in earnings and above, that may be true because a lot of the larger regional multi-state or multi-city healthcare practices that are sold to private equity are the types of businesses that private equity buyers compete to purchase. But for the vast majority of healthcare practices, you're talking about companies that are not only below 5 million in earnings, but typically below 1 million. Some may have only a couple $100,000 in revenue. And that constitutes the majority of the marketplace for healthcare businesses. For a lot of the businesses, such as the smaller ones I'm describing, it's actually the opposite because it's finding the real buyer that's the hard part. In fact, once you find a buyer, the process of getting the transaction across the finish line, it involves a couple documents that if you went to get a certificate program or if you went to university or medical school and you have advanced education, you're going to be able to read these documents and understand what's in them. There's a little bit of work in the transaction, but at the same time, it's really finding the buyer that's the big variable to get the deal closed. In fact, when you actually look every single year and you look at the number of businesses that are listed for sale, at any given time, only 20 to 30% of the businesses that are listed for sale actually go on to sell. And there's a number of reasons for that we'll talk about in subsequent videos on this channel, but it's enough to say for right now that the process of finding the buyer is going to be the bigger variable. And once you have that buyer, getting the transaction closed is actually relatively straightforward. Another big misconception that sellers have when they start the process is the belief that once the deal goes through, the transaction closes, they get paid and they hand over the keys to the buyer and they walk out the door and that's their last day in the office. But it's actually not true because very often what happens is that the process of selling a business involves a significant transfer of risk away from the seller over to the buyer. And also beyond that, the financial performance of a small business, any small business, healthcare or otherwise, is often going to be dependent on the ongoing involvement of the owner. In other words, if you're an owner-operator of a business, the value of that business is different with your involvement versus without your involvement. For that reason, a lot of buyers structure their purchase offer with the seller contingent on a predetermined 1 to 2 year transition period where the seller is going to stick around and just make sure the transition goes according to plan and that the buyer can eventually be successful. Another misconception that sellers believe, especially at the beginning of the process, is that they assume that whatever price is negotiated with the buyer, they're going to receive 100% of that money at closing. But that is rarely the case, especially when you're talking about small business transactions. In fact, a lot of people know about the Small Business Administration or SBA loans. It's a very common, very popular loan program to facilitate funding for small business owners that are looking to buy a business and create jobs in America. But the SBA loans, for how well known they are, they're actually not used as frequently as you might assume in the day-to-day, business transactions like the ones that we're talking about. In fact, the most common funding mechanism that you may see the buyers use is owner finance. A lot of people are confused by this because it's something that a lot of sellers don't think about, but believe it or not, about 60% of all small business transactions involve some form of owner finance. All that means is that the purchase price that the buyer and seller negotiate involves some portion as a down payment directly to the seller, And then the balance is structured with recurring payments over monthly, quarterly, or annual payment intervals to cover the balance of the purchase price that's deferred. The reason that's done is to facilitate the alignment of incentives between the buyer and seller after the transition closes so both parties can be successful. The question remains, though, why would a seller actually consider owner finance? Because if you're able to have a buyer go out and get a loan, you get all your money out at closing, and maybe that's a better way to go. And some people agree. A lot of people feel that way, and a lot of people are not interested in entertaining owner finance for that reason. But as far as the reasons why all these sellers that sell their businesses on owner finance discover the benefits of it, there's a number of distinct advantages for the seller that people don't consider. Number one is that you can typically sell your business at a higher purchase price. Number two is the transaction process is typically going to be much faster. The ability that you have to generate predictable income after the sale goes through is so underrated because year one, year two, year three, to get monthly income in a predictable cadence above and beyond any income you generate from your work or anything else that you're doing is actually something that's really comforting for sellers in that transition period. You're also able to access a larger pool of potential buyers in the market for your business, in addition to making the transaction much more likely to close if you agree to work with the buyer on payment terms. The last one's confusing, like why would owner finance make a deal more likely to actually close? The reason why that's true is that there's this old saying that time kills all deals. What that means is that the longer that the deal stays in due diligence prior to closing, the more likely it is that the seller gets tired or the buyer loses motivation or something happens in the business and it changes the risk of the acquisition. The longer the closing timeline is, the more likely it is, no matter anyone's best intention, that the deal falls apart. Nothing guarantees a longer due diligence process than the buyer getting a loan from a third-party lender. So for example, if your buyer is getting a loan from an SBA lender, you're talking about a couple extra months on due diligence right there. But in addition to actually lengthening the due diligence, what also happens is that that lender is going to have to get an appraisal of your business. What that means is that they're going to be all up in your grill. They're going to be asking about every kind of document that you could possibly imagine, and some that you probably can't. And they're going to be pulling documents and asking for all this stuff. And it's going to be like so up close and personal just with the lender, forgetting about the buyer's due diligence on top of that. But then once that's done, if the appraisal comes in low, the problem is that the buyer's probably going to renegotiate price, because if they're relying on third-party lending and the appraisal comes in low, that lender's only going to loan up to a certain amount. The buyer has a budget, they have so much working capital that they need to set aside. And if they have to put more as a down payment, it affects the amount that they're going to be able to pay you overall. And they're probably going to negotiate to a lower price. And so for that reason, you want to be mindful of the trade-offs between selling on owner finance versus selling to a buyer that's getting their own loan from a third-party lender. But just because you might sell on owner finance doesn't mean that you can't get a good down payment, because typically you can negotiate 20 to 50% of the purchase price right there at closing. Probably the last misconception that a lot of sellers have, especially in healthcare, is that for whatever reason they believe that there's this big risk that the company that is going to complete the purchase and take over their business operations, for whatever reason, is going to want to do away with some or all of their staff. While administrative redundancies are certainly a possibility and it can happen in the context of a small business acquisition, the reality is that, like, for most buyers, the biggest concern that they have is actually the opposite. It's how do we retain the staff during the transition period? Because if the deal goes through and they know there's a new owner, how is that buyer going to make sure that the operations and the financial performance of that business remain consistent when they're working with a team that they haven't worked with before and the original owner of that business has sold their stake in the company? Administrative staffing creates leverage in healthcare practices, and it's very important for the financial performance of healthcare practices that you have a good administrative staff, because having more of an administrative layer in the business creates more operating leverage for the providers to focus on patient care and the unique patient care and revenue generating activities that are going to drive the financial performance of the business overall. And believe me, when you sell your practice, if you ever decide to sell your practice in the future and you're talking to the buyer directly, in the back of that buyer's mind, it's a very good chance that what they're thinking about is, how can I create an environment after the deal goes through to incentivize the staff to stick around?